Thanks for giving me the opportunity to talk here. I think I have a very tough act to follow with regards to, after Dr. Velu mentioning about his life history. I can only speak about what Abbott is trying to do, right? And that is maybe not as emotional and not as motivational for many of you. However, from a industry perspective, from a diagnostic perspective, I personally believe this very strongly. And yesterday the framework that was being discussed with regards to the value, adding value to the healthcare system. That is also something that Abbott is very strongly passionate about, and that is something that we want to do and help to drive towards a better healthcare performance, right? So, I don't think I need to pitch to the converted already over here, right? We all know the value of healthcare, right? Medical decisions, 70% of medical decisions are pretty much based on the reports that we give them, right? And we know that for every 30 minutes delay, it increases the length of stay for the patients. And that is also one of the fundamental reasons why one of the most important KPI for the laboratory is turnaround time. We want to improve the turnaround time so that we can have an impact on the patient's healthcare, right? And of course, accurate result, early diagnosis, early treatment, it's all known fact. That leads to better healthcare, right? And, one of the things that Abbott actually did, earlier this year is that we went out to do a massive, huge worldwide survey. It's a worldwide survey, believe me in that. And we tried to ask questions of what can the lab do for the patients to impact on the satisfaction of the patients, the clinicians, and even the staff that we have. And we have a very interesting finding here. You will see that most of them says that lab has a big impact. I'm sure you agree with that, right? One major difference or major insight that we got from this survey is that there's a disparity. A disparity between what the healthcare executive thinks. 70% thinks that a lab has a massive impact, whereas the lab themselves are more conservative and think less of that. Why is that the case? Why is it that the lab and the health executive are not being aligned in the expectation of what they can do to contribute to the satisfaction? And this is a finding that we find it very interesting. And yesterday I believe that there was a mention about data. How getting more data is able to ask us the correct question. And this is the question that we try to ask. And we try to find out more. And one of the things that we realized and we found out from talking to laboratorians like yourself is that the lab is seen as a vending machine. A test goes in, a result comes out, and they could be very, very effective. And yesterday, during the panel discussion, I also hear the word kitchen. A manufacturing site, a factory, a kitchen. Does that resonate with everyone? A lab is like a kitchen, right? Is that the fundamental reason why the laboratorians view that they have a less impact on the satisfaction as compared to the executive who wants more? Could that be the reason, right? One of the more difficult things about a laboratory is proving value. Yesterday we talked a lot about proving value. How can we change the paradigm? How can we find a new pie and not get into the, eat the same pie? Dr. Arora mentioned yesterday. The pie is the same. We are all eating into the same pie. What can we do to find different pies, right? And it's not easy because the test result that you're generating from your laboratory, even though it goes to a clinical decision, but the actual health-related outcome is unclear. We can say that, yeah, my test result is more accurate and therefore the clinician can make a better decision and hence it leads to a better healthcare. What evidence is there? Or what direct evidence are there for this? How do we know for sure? How do we know that it is not the clinician who is making that decision based on his expertise, which is what pretty much a lot of clinicians do. They will say that, yeah, lab report. I use it to base on some judgment and then I make my own decision. The reason is simply because lab test results does not necessarily quantify or correlate directly to the healthcare related outcome. In order to prove the value that lab is bringing towards the healthcare system, it is extremely important to provide the evidence, to quantify it, and to tell the executive, this is what I am bringing to the healthcare, right? And, traditionally laboratories, in order to cope with the huge demand, in the India context, there is a huge demand, increasingly demand. And with the new healthcare system that's coming on board, that demand is going to go even higher. Earlier on, Dr. Velo mentioned about volume. He knows how to quantify the cost with the volume. If he were to get 100 tests, this is the amount that he's paying. 10,000 tests, this is the amount that he's paying. And 1 million tests, this is the amount that he's paying. Right? So laboratories also try to do that. And a lot of times, we look at the lower hanging fruit. We look at technologies. We look at how operationally we can do things better, more efficiently. And that is why you see this value trend. This is the value trend that the industry has been going towards. We built on top of it technologies, total automation, total lab automation, informatics, lean workflow, quality. We do a lot of activity, we do a lot of improvement to enhance the value of the laboratory. Is it sufficient? Maybe currently it is sufficient. However, if you believe in this curve, there is a performance expectation gap. If the trending of the volume increase carry on, how are we going to do only operationally improvement in order to close the gap? Albert Einstein says that you can't solve problem by using the same kind of thinking we used when we created them. Volume will only increase. There's no question about that. Is the kitchen going to become a bigger kitchen? Is that how we are going to cope with it? Or maybe decentralizing, going towards the regional, is that the solution? Is operation the only way that we can resolve this healthcare paradigm? Right? In Abbott, we believe very strongly that we need to change this. We have a lot of technologies. Yesterday, we even talked about all the molecular improvement, the new testing, and so on. Right? There's a lot of technologies, and technologies is only going to improve even further. However, only with technologies, I personally don't believe that is enough. The paradigm mindset change is important. How do we convert the data that we have on hand into insights, into actions? Yesterday, there was, the panel discussion about the next generation testing. A lot of data was generated from there, and therefore they can do further things, right? There's a few molecular companies in this audience. How about the core laboratory, the biochemistry? Do we believe that we have already crunched all the data and gained all the insight that is possible from it? Even though I know that there was a mention that the core laboratory, the biochemistry laboratory is pretty much automated. Have we already, extract all the essence of the core laboratories and turning them into actionable insights that can really help the healthcare system? How do we change and transform the lab from a kitchen into a decision support center? This is a big question that Abbott is trying to do or trying to think about. How do we change that? The value creation. In the current healthcare system, if I may make a analogy, we are actually not healthcare. We are actually sick care. We are treating the sick patients. However, how do we convert the sick care into healthcare? And that is where we change the paradigm or the change of thinking and the mindset, changing it from going beyond as a kitchen into a decision support center. And in order to do this, what Abbott is trying to develop or think about or go the direction is how do we actually utilize real-time actionable intelligence? The data that you have in your laboratory, right? The data that you have, combine it with a very standardized operational process, a SOP, to make it more efficient, to make it more aligned. I think in every organization, one of the biggest challenge, including Abbott, we have is alignment across the stakeholders. How do we get everybody on the same page, going along the same direction? Right? The confident stakeholders, decision maker, or making. How do we get that all aligned? In the healthcare system, it's not just the lab. There's payors, there's clinicians, there's patients, and there's executives like yourself. Getting this alignment across everybody is extremely challenging and extremely difficult. I myself has been in Abbott for a few years, and that is one of my biggest challenge. I want to do something, we want to do something, but we spend so much time discussing it to make sure that everybody understands it. Same thing for healthcare, or same thing for the sick care. Importantly also, once you get the alignment, once you get the understanding of the action, the strategy, how do you prove and measure something that is really correlating back? How do you do that? Is it just because we say so? Is it just because just now I flashed my very first slide? 70% of medical decisions are based on laboratories. What evidence do we have on that? Have we actually directly quantified it? From my experience, I've not seen it. Maybe you can educate me on that. And hence, that measurement of the KPI of them is extremely important so that we can justify for what we are trying to do, a measurably better healthcare performance. And this, in Abbott belief, it has a very big ripple effect. How do we combine operation of the laboratory, which laboratories do very well nowadays? They are very constantly improving with automation, with new technologies and informatics utilization. How do we couple the operational piece to the clinical side to have a real direct impact on the patient? And we know that in the healthcare, in the laboratories, right, we have a ripple effect. The lab contribute to the hospital. The hospital contribute to the healthcare system. And the healthcare system contribute to the community. It is a continuous journey. It is a paradigm. It is a ripple effect. And hence, a lot of the effect on the healthcare system, on the community, starts with the laboratories. And this is why in Abbott, we are trying to get people to come together and work together. What we call a collaboratory. We want to break the barrier. Too often we have seen that the lab work as a silo, the clinic work as a silo, the procurement work as a silo, and so on and so forth. Everybody work as a silo. However, to really get towards a healthcare, we can no longer afford that. Everybody needs to work together. Abbott cannot work alone. Labs cannot work alone. Clinicians cannot work alone. It is important to couple the operational efficiency to the integrated clinical care to ensure that there is a proper healthcare alignment and achievement of the healthcare that we want to achieve. And some countries, some hospitals are actually already doing it. You may not be able to see the screen very well. Let me just quote you an example. In the Swedish Covenant Hospital in Chicago, they have instituted PCT, which I'm sure you know what it is, for sepsis. They've instituted PCT in the emergency, in the ICU, right? They did an initial pilot screening whereby they make sure that there is a measurable impact. They start off with a very small section of the ICU, and once they see the impact and calculate it, they expand it to the whole entire ICU, and then go towards the emergency department. All they did is very simple. They just screen for PCT. Full stop. That's it. And they see that by having a little bit of investment on the PCT testing, they can reduce the length of stay by 1.3 days. Can you imagine the amount of anxiety you have less with reduction of the ICU stay? The amount of healthcare saving that you can potentially get from that is tremendous and is cascading bigger and towards the whole community as a whole. Right? So this unifying across the care continuum, is extremely important. It starts off with the patient, the payors, the clinicians, and finally, executive like yourself. We need alignment across everyone. Lab cannot do it alone, right? And this is also one of the reasons why Abbott created this program called the Unifying. Yesterday, Narendra mentioned very briefly about the Unifying. I don't have the time to go into the depth of this. So Unifying is meant to encourage and reward healthcare providers to work together as a continuum in a measurable way to make sure that whatever we are doing has a true direct impact on the patient. Let's move away from a sick care to a healthcare, right? And Abbott didn't do this on our own. We have a lot of partners, very established, recognized partner, ISCC, AACC, which you know very well, the HIMSS, the Modern Healthcare. Perhaps India Express may want to consider about joining this Unifying program as well, right? So this is a program that is universal, it's a worldwide thing, and in 2018. There are 4 honorarium winners already awarded for it, and this is what I just briefly mentioned earlier on, the PCT. And in Canterbury, in Wolverhampton, they have instituted troponin into the emergency department so that it can accelerate the pathway to reduce the length of stay in the emergency department to improve diagnosis of AMI patients. And in Germany itself, they actually do screening of HbA1c on all the patients that comes into the emergency department so that the patient will be treated with the HbA1c, the glycemic index in mind for healthcare. And that has proven that it has improved the patient complications, the potential complications, right? So I encourage you to go to the website to read their story, unifying.hce.com, unifyinghce.com. We have the stories on there, and this is where you can get to know a little bit more about the program as well. The closing date for 2019 is actually 31st of March, so maybe you have still about 1 month time. I know that from yesterday, I was speaking to a few of you, you are actually already thinking about doing that, or you are already doing something similar to that, right? This is not an Abbott program. Abbott do not make a decision on the winners. This is based on all the partners that is involved in it to select and to make sure that there is an impact of the laboratory on the hospital, on the community, and the healthcare system. We want to move away from a sick care to a healthcare, and in order to do that, it is extremely, extremely critical to make sure of the continuum of the engagement with all the stakeholders. All right. With that, I thank you for your time and attention.